Welcome back, everybody. Well, how sick are Americans? The Centers for Disease Control says half of us have at least one chronic disease or more, and more than a quarter of us have two of those chronic illnesses. So Dr. Bushra Shah is in with the Longevity Center at CHI to talk a little bit about what that study means and really what are we talking about when we say chronic disease. It's good to see you.
Good morning.
Yeah.
Good to be here again. Chronic diseases, our Centers of Disease Control is our institution that we look up for guidelines and data that they report. And they had, from their report, half of Americans suffer from at least one chronic disease, like diabetes, obesity, coronary artery disease. And a quarter of Americans are suffering from more than two diseases, obesity, coronary artery disease, COPD. So those are the chronic illnesses that we're talking about.
Very good. You know, these are in the news all the time. Why are we having such a hard time getting a handle on these kinds of illnesses?
Well, it's about making healthy choices. And, you know, there's some things that you cannot change. You can't change your genetics. You can't change, stop aging. You can't change your gender. But we can make healthy choices. And those healthy choices have to be made as early as you can in your life. You have to give up a lifetime of bad habits almost. So we're talking about if you are a smoker, stop smoking. Healthy diet. Cannot emphasize, you are what you eat. So lots of fruits and vegetables. Moderate amounts of fat, sugar, and you know, things that say high fructose corn syrup. That's poison. Read your labels. Do not take food items that contain high fructose corn syrup. Also, alcohol. If you don't drink, don't drink. But if you do drink, for women, it is 1 glass of alcohol a day, and for men, 2 glasses of alcohol a day. It's about exercise and not being sedentary. You should do at least twice a week, vigorous to moderate aerobic activity, which gets you to exercise or work out your major muscles, including your hips, your legs, your back, your chest, shoulders, arms, abdomen. You should be able to work those at least twice a week. So those are some of the healthy choices that we're talking about making, and making sure you're getting rid of the toxicity in your life, not ingesting toxins. You know, those are just some basic things. And if we adopt that lifestyle, we can prevent these diseases.
And hopefully our blood pressure comes down, our cholesterol levels come down.
I mean, you should know your numbers. You should know what your blood pressure should be. Do you know what your blood pressure should be?
Not really. I know it's usually pretty good when I get it checked.
But everybody should know their number. 140/90 is the new JNC guideline. Before it used to be a little stricter, 130/80. But your top number should not be over 140. Your bottom number should not be over 90 if you're 65 and under, or if you don't have diabetes and kidney disease. But if you have those two illnesses, your blood pressure should definitely not be over 140/90. So you should know your numbers. You should seek treatment. And if you seek treatment, take your medication. Don't be lax about it, because if you don't, you're going to get bad outcomes like strokes and heart attacks. And you should know your cholesterol. Do you know your cholesterol?
I don't.
I'm not putting you on the...
That's okay. I know I've had it checked and it's okay, but I don't remember the numbers.
Your cholesterol, your total cholesterol should not be more than 200. Your bad cholesterol should not be, that's your LDL, should not be more than 100. Your good cholesterol should be between 40 and 60 or higher. So those are the numbers that you should know. And if you don't, if you're not in that range, you should see your doctor. You should get treatment. If you get treatment, take your treatment, and then follow up with your doctor to see the treatment you're taking, is it really making an improvement or not? But because there's no guarantee, there has to be follow-up with that too. So, and physicians and researchers have come to a consensus that if we follow the healthy living tips, if we seek treatment, we can prevent the bad outcomes, and we can even prevent developing illnesses like diabetes, like coronary artery disease, like COPD. So if you don't do these things, and if you are a young adult or a teenager and you know somebody in your family suffers from this and, you know, has struggled with it, don't walk that path.
Right.
You know, you can avoid it and you can prevent it.
So much we can do to change those things. In fact, we want to mention there's sort of a website that's titled We Can that has a great resource.
Yes, the National Institute of Health, this is a great resource, and there's a 3-step program, eat right, get active, and reduce screen time. So this is meant for families and parents. It's a resource that you can get. It gives you shopping tips, it gives you meal plans, it tells you physical activities you can engage in.
For the families.
For the families, so that you're reducing television and computer time. And there is a website, which is, I think, on the screen.
There it
it's
is.
quite lengthy, but
Yes.
I would tell the viewers, go to National Institute of Health, We Can, and look up this website. And, you know, the United States being the leader in the world for, you know, we are the world leaders, especially in medical health and research, and still we are lagging behind our other the countries who are high income, in that we have more of these chronic illnesses here. And they run up the cost of health care.
Right.
They are a major cause of disability and illness in this country. So we really need to kind of get on the on the path of...
I was thinking so much talk about awful Ebola and everything, but this is here, these chronic illnesses, and we can change it. All right, we want to put up the information, of course, about CHI St. Vincent. That's where you can find Dr. Shah, but there's the information about the website. Thank you so much for coming in. Back in just a moment, a look at fashion from Park Plaza.